Thank you very much for coming. Welcome. We're going to get started now. Please allow me to introduce our panelists. On the far end, oh, you guys, we sat you in the order. I have you on the list. That's just luck. On the far end, we have Dr. Gagan Pawar, who is CEO of Clínica del Camino Real. Ellen Goldstein is the Executive Director of the Sansum Diabetes Research Institute. Fatima Gelmain Rodriguez is CEO of Ronald McDonald House Charities of Southern California. And Lorna Little is President and CEO of St. Anne's Family Services. So welcome, and thank you so much for coming tonight. So first, I would like each of you to briefly describe what your organization is, what it does, and the primary population it serves. You can decide whatever order you want to go in.
Good evening, everyone. As mentioned earlier, my name is Gagan Pawar, and I am the CEO of Clínicas del Camino Real. We are a healthcare organization which serves the underserved population of Ventura County. So we provide primary care, specialty care, as well as dental, optometry, mental health services to every community member of Ventura County. So we've been pioneers in leading in the pandemic as well with COVID-19, and have been in this community of Ventura County for 51 years now.
Thank you. So it's my pleasure to be here. And I'm Ellen Goodstein. And as mentioned, I am the Executive Director of the Sansum Diabetes Research Institute. And what we do is right in our name. We provide cutting-edge research, education, and clinical care for people with diabetes and in the diabetes space. All kinds of diabetes, type 1, type 2, late onset diabetes, gestational diabetes. And we have not only clinicians that help patients, but we have educators, nurses, nurse practitioners, and lots of research assistants. And our population, as you might expect, that's people with diabetes. That's who we serve. Not just locally, but nationally and globally because of the research work that we do. And so I welcome tonight's appearance, and I look forward to questions later.
Okay, good evening, everyone. Again, my name is Fatima, and Ronald McDonald House Charities provides comfort, care, and support to children and families. In particular, children who are being served by a local children's hospital. So we have 6 houses throughout Southern California that are currently in operation, and they're all located within a few miles of a major children's hospital so that the families can go back and forth between staying at a Ronald McDonald House and being with their children. We're building a 7th house over by UCLA Children's Mattel Hospital, and we also have 3 family rooms. We just opened up our first family room in a county hospital in Ventura. So if you're looking for a volunteer opportunity, we do have our family room in the Ventura County Hospital. We also have a year-round camp for children with cancer and their families. And we have as well we have the family rooms, camp, and the houses. So the population that we serve, children and families.
Thank you. Hello, everyone. Oh my goodness, no one's here. Hello, everyone. Okay, I feel a little better. My name's Lorna Little, and I am from St. Anne's Family Services. We are a nonprofit organization that has a variety of supports and services. We provide housing, early childhood education, so we have Head Start programs throughout Los Angeles. We have a variety of supports that provide wraparound services, mental health services, and when we talk about the housing component of what we provide, many of those services start with our youth and foster care. Many of the young people who are involved with the foster care system come to our program pregnant, sometimes parenting, and we provide training, parenting support, guidance, and then look at the whole system in terms of wraparound services, making sure that all the needs are met. One of the things, and I won't go into too much detail because I know there'll be more questions, one thing that was very important to St. Anne's Family Services is looking at each stage of what is necessary to provide an opportunity for success. So we started with young women who had children. And then we realized when they were aging out of the foster care system, there was nowhere for them to go. And so then we went into transitional housing, and then we realized, okay, well, what happens after that? And then we went into permanent supportive housing. So between, you know, health, nutrition, all the areas, we may not be directly connected in that way to the medical community, but we are indirectly connected and with all of our prevention and intervention services. And the population, children and families, I always say up to, right now, probably our most senior client is probably about 50.
All right, thank you. Can you tell us how you make the population you serve aware of your services and your organization?
Well, in our early childhood education program, our Head Starts, there's a variety of efforts and initiatives. We're involved in a lot of community organizations. Our teachers and our recruitment specialists are out working in the community, looking and talking with parents who are seeking our services. I mean, it was really critical during the pandemic. You know, people still had to go to work. Many frontline employees had to go to work. And then we had our teachers who were also dealing with the concerns around COVID and safety. And so they were out there saying, we're here for you. We did online learning. So we're recruiting at community centers. We're a part of the community. One of the things that we pride ourselves is we're not this agency off to the side. So our staff are a part of the community. So we make referrals. The county does a lot of referrals into our housing programs because many of the young people are connected with DCFS, or there's a juvenile justice component. And so we get referrals from the county, state, and medical, you know, providers. So it's a combination of referrals.
Thank you. So for us, it's really through the child life specialists and the social workers in the hospital. So if you call a Ronald McDonald House and you say, you know, I have a child who is being served at Children's Hospital, they'll tell you you need to talk to your social worker or child life specialist to determine if you qualify to stay at a Ronald McDonald House. Essentially, we're trying to serve families that are in a long distance from the hospital. And in some cases, because in Los Angeles County especially, you could live just like 10, 15 miles away, but if it's gonna take you an hour or longer, you can still qualify to stay at a Ronald McDonald House. We serve families from all over Southern California, but we also have a lot of international and out-of-state families who come to us as well, because we, you know, in California, we're fortunate to have these Research Institute hospitals that are doing incredible, you know, studies and care for our children. So we have families that are coming to us from all over the world, and again, primarily referred to us through social workers and child life specialists.
So I think to be really effective in terms of getting the word out, you have to apply a number of different techniques. So one of them is through collaborations with other organizations. We also participate in many activities in each community. For instance, if there's a health fair that's put on at the West Side Community Center, we're there. We also do a lot of outreach. For instance, one of the markers of how healthy you are in relationship to diabetes is your A1C. And your A1C is a measure of your blood sugar over a 3-month period. And so we'll go out and we'll advertise. So we'll use newspapers, radio, social media. That's a big deal, both in English and in Spanish. So we'll say, well, we're going to be at, you know, this barber shop doing A1C testing. And so we'll get a crowd of people that come to the barber shop. The other way we get the word out is through local physicians, and we also have members of our staff that are part of the community, particularly in the Latino community, where type 2 diabetes is a real epidemic, unfortunately. And so we do a lot of outreach with members of the community that are well accepted, they're culturally, you know, specific, and they're easily identified, and it's like peer-to-peer. And that's a very, very effective way to get the word out for us.
So for clinicas, we have 15 clinics in Ventura County right now, so health centers. What we do, I think similar to what you said, is we go in health fairs. We go in, we actually have our own health fairs as well. In Oxnard, we do a lot of marketing and advertisement as well. In Ventura County, we serve about 80,000 patients, so what better than actually getting our name out through the patients. So the other thing that we are working on is a digital platform as well right now to have members know more about the organization and the new health centers as they are opening. And we hire community members as well, so they are either have been patients or refer patients, because when they wear the Clinica's shirts or anywhere, that's an advertisement in itself, and they ask, where do you work? And then they are referred as well. Thank you.
I did want to add really quickly, the housing component outside of DCFS and referrals to social workers, our permanent supportive housing, most of our referrals come through LAHSA, the Los Angeles Homeless Services Authority. And so there's a coordinated entry system that was created to help people who are looking and in housing crisis, providing them the ability to get a referral into the system. So many of our referrals for our housing, permanent supportive housing, comes to us that way. But I think the important part is understanding, as you said, being a part of the community is critical, because no one wants this kind of outsider, these people who don't know who you are and know what you're about, to be telling you what you need to do with your health and your home, your housing situation.
So the next question, you've all answered to some extent, so feel free to elaborate as much as possible or as much as you feel necessary. What specific gap or need in the healthcare system does your organization fill that isn't already being met by other organizations?
I guess I'll go. Well, one of the things that makes us unique is we're one of the few programs that serve pregnant and parenting youth in the state. We have a specialty in filling a gap with those young people. A lot of times there's so many needs there. Sometimes they've gone through serious situations where there's been trauma. Sometimes there's been abuse. And we're there providing the gap for those young people who have made a decision that they wanted to try to parent their child, but they're young themselves and they've gone through so much within the foster care system. So we're making sure that we're taking care of both generations. The child, giving them that jump start, teaching positive parenting, giving the nutrition, the health, support, making sure they're connected with wellness visits, making sure they're getting the prenatal care. And so that gap allows us to actually do a lot of prevention work. It's intervention, but there's a lot of prevention work. We're making sure with our early childhood education program that any assessments that need to be made for any potential developmental issues that occur, that someone may not know what this child is range to do at that time. When do they crawl? When do they walk? When do they start to talk? And it's different for each child, but we provide all of those supports to help them parent to the best of their ability. So I think that's a special gap. And I know you hear a lot about ACEs and what that looks like. We're trying to prevent some of those challenges so that they don't have some of those medical issues and emotional issues down the line.
For us, it really is about bringing the family to a place of wholeness, and having a child who has a critical illness or some sort of critical injury is really traumatizing for our family. The way that our therapist who oversees our family support services equates it to is like you're living in a rom-com and all of a sudden it goes from a rom-com to a nightmare in a matter of a split second. So that's the reality our families are dealing with, because nobody expects a child to be critically ill or injured. So Ronald McDonald House is not just a place for a family to stay, it's a place for them to be in community with other families going through a traumatizing experience. It's also a place for them to get some rest. A lot of our families, if they didn't have a place to sleep at the Ronald McDonald House, then they would be sleeping in their car, or they would be sleeping bedside with their child. To pay for a hotel, it's $250 to $400 a night. We ask our families for $25 a night, and 75% of them pay nothing to stay at a Ronald McDonald House. On average, they're with us for 55 nights on average. And our families are with us for 55 nights. Oftentimes they go home and then they come back, because especially when you're talking about childhood cancer, the treatment process is anywhere from 1 to 3 years. So they're coming in and out of the hospital, and the Ronald McDonald House is always there. So I think when we talk about family-centered care and having the family part of the medical process, making those important decisions for the child's care, Ronald McDonald House fills that gap of giving them support, giving them a sense of peace, putting them in a place of community so that they don't feel so isolated and alone.
And thank goodness for the work you do. So, as I mentioned, we focus on diabetes. And unfortunately, in our community, and we're up in Santa Barbara County, and in terms of health, the provision of health care, if you need to see an endocrinologist in our county, you might have a 3-month wait. And so that's a gap that we fill. A parent who has a newly diagnosed child with type 1 diabetes, they know that they can come to us and we will help them. We have a pediatric endocrinologist that's works with us, and also we have a lot of staff that is, they know what it's like to raise a child with diabetes. I know what it's like to raise a child with type 1 diabetes. And so we have a really wonderful one-on-one mentoring program that we will help parents that, when your child is first diagnosed, it's a very scary thing. And you just really don't know where to turn. Well, they can turn to us. And also, we specialize in caring for women whose pregnancies are complicated by diabetes. And we're the only ones in the area that do that, and we're known for that. Actually, one of my predecessor, who unfortunately is now deceased, but she developed the protocols that allowed women with diabetes to birth healthy babies. Because prior to her work, women with diabetes were told not to have children because the risks to the mother and the child were too great. So we are very well known nationally and internationally for our clinical care and our research with pregnancy and diabetes. So that's just a few of the areas that we fill the gap. And there are a few more, but I don't want to go on forever, so I'll pass them.
Thank you. So if you've ever used healthcare yourself, or have been hospitalized, or have had to use any kind of health insurance, you would probably agree with me that healthcare is very complex. And for people who don't know where to find those services, it's even, and when you're sick, you have to seek care, you don't know where to go. So what we do at Clinicas is we have our enrollment specialists who help not only, like we have clinicians who are seeing physicians, who are seeing patients, but we help connect our patients with CalFresh. We help them figure out if they qualify for any insurance, if they can be on any kind of patient assistance, if they are diabetic and they don't have insurance, what kind of plans they can be to get their supplies. The other thing is, what we try to do is we do heavily support the agriculture farm workers in Ventura County. So when you're at the farms, it's really difficult to come for a doctor's appointment. So we have mobile units for dental and for medical units that we take out to the farms. We've actually done dental screenings for children in their schools as well. And so that's kind of what the gap is there, I think, everywhere in healthcare, but even in our county right now, which is when in need, where to go. And I think we are well known in this community that they can come to us, and if we don't have the service, we would connect them with case managers to the needed services.
Forgot that it was my turn now. Several of you have mentioned collaboration. So what other organizations do you collaborate with, and what does that collaboration look like?
Let's change up the order. Okay, so We collaborate with local hospital, Cottage Hospital. My understanding is they were here earlier today. So that's an important collaboration. We also collaborate with Santa Barbara Neighborhood Clinics, which has a very large population of people either underinsured or uninsured. And we collaborate with them. We refer to them and they refer to us. We also work closely with the local physicians because they'll send us referrals as well. And then there are a lot of other organizations like the United Way, as an example. And you know, if you work in nonprofits, you get to know other people in the nonprofit field. And you know, I'm amazed at all the opportunities there are for collaboration. And it creates a wonderful community of people who have their hearts in the right place and are doing good work. So I'm really proud of really all of California's nonprofit communities. So I know there's more collaborations, but I'm open for more.
Sure. So our collaboration is with the local hospitals to start off first. So we have, if you're in Oxnard, you know, Dignity, St. John's Hospital, we collaborate with them because that's how we deliver our babies and admit our patients. We have at Ventura with the Community Memorial Hospital and VCMC system as well. So our other collaboration are with local organization. If you've heard of MyCOP, that is for the indigenous population. That's where the centers are. So we collaborate with them as well in order. Again, it's very important to be part of the community when you're serving them so that you have that trust in you. Apart from that, we not just locally, we have federal collaborations as well, given a healthcare organization, as well as national collaborations with CDC and other organizations because we are Joint Commission accredited. Maybe it's too much, but like a leader in quality is what we are, so we collaborate with a lot of the other organizations as well.
I want to just add one thing. I'm concentrating on healthcare, the provision of healthcare, but because we are a research institution as well, and about, I would say, 70% of our work is in research, we collaborate, internationally. We have very close ties, and we do a lot of studies with places like Harvard University, UCLA, USC, Stanford, the Mayo Clinic, University of Virginia. Depending upon the study, there'll be collaborations with other academic institutions and other research centers. And we've also collaborated with research in Israel and France and in Spain and in Latin America.
So we primarily collaborate with the children's hospitals, and I mentioned the social workers and the child life specialists, but we also collaborate with the strategists at the hospitals and the operations staff, so that as we're thinking about how to improve our programs and how to continue to support the hospitals, we involve those that are more on the strategy side from the hospital. We also collaborate within the Ronald McDonald House Charity System. So even though I oversee Southern California, we're part of a global organization. So we are located in 65 countries around the world. And so that's a wonderful, I think, unique component to Ronald McDonald House Charities. Even though we are our own 501c3, I meet on a monthly basis with other CEOs from across the country, and we talk about best practices. We talk about sharing resources, sharing ideas. So I think those are the two big collaborations. But I am, in my new role as CEO, I was just promoted in January, looking at what are other ways to collaborate. We had, for example, a mother the other day, a few months ago, that didn't have, her son didn't have shoes on, and come to realize that she didn't have clothes for her kids, and she didn't have clothes for herself either. They were coming from Mexico, and her son was getting a heart transplant at UCLA. So I reached out to Dana, who's the Chief Development Officer at St. Anne's, and knowing that they have a thrift store, they have access to resources, I said, hey, do you guys have clothes and things you can provide for this family? And right away they rallied. So that was just a phone call that I made, and St. Anne's was there for us. But I'm mindful in my new role. I feel like I have to take care of things internally first, but then start looking outward for future collaborations.
Thank you. Proud to hear you share that, because one of the things is people often think we only provide supports for people directly connected with our program, but we actually get a lot of those calls. We work with, a lot of talk about social determinants of health. You guys are directly talking about some of the healthcare aspects. We're making sure that there's the housing component, and we have to collaborate with all the people who are able to provide housing. So our folks, you talked about rest earlier. Getting a good night's sleep is something that creates a kind of level playing field to start your day. So we're providing housing. So we're working with all the agencies providing housing. We work with Queen's Care. We work with Altamed, Clinica Romero. We have children. We have about 600 children in our early childhood education centers. And a component, if you don't know, involved with Head Start programs is the wellness component. Our teachers are working and collaborating with various medical providers to make sure that those wellness checks, the dental van, we've had those as well, making sure that they get that. We're working with workforce development. You say, well, what does that have to do? Training them to be able to be self-sufficient and sustain themselves. Well, the stress that goes with not being able to have the financial wherewithal to buy the shoes, to do the things that you need to do. So we're collaborating with all the different entities that are allowing us to be able to give them what they need to be able to, live their best life. But Queen's Care is one of the providers, and Altamed and Clinica Romero have been some of the strongest alliances, as well as organizations within the community that are helping hire them so that they can get that experience. So collaboration is key for us, and we continue to look for more collaborators. We are located right outside of downtown LA in the Rampart District, by the way. I didn't share that.
Thank you. And I realize this next question might have a long list, so please pick the top one or two. What are the greatest challenges your organizations face in trying to meet the needs of the people you serve?
Is money taken off the list?
I-
Because if we just scratch that part, we can move forward.
Money is number one for everyone, yeah? Okay, so number 2 or 3? Yeah.
I think workforce is the key for us right now. So I'm hoping we can recruit some here today. And I love your Clinica shirt, by the way. So, but yeah, the swag right there. So, but workforce is a big one right now, and I think it's everywhere in healthcare. I think it's globally right now, but in healthcare, the numbers are people have either due to burnout left healthcare or taken a break, or have just went into a different profession. So that's a big one. And actually, Clinicas is collaborating with the local college right now, which is Oxnard College, to create paths for different levels, front desk, other kind of non-clinical roles as well. Other is the challenge is the evolving system of how healthcare is delivered right now. The delivery models have changed. For us, it's been telehealth. We were talking about it for many, many years, but come March 2020, we had to go from one day to the other. And how do we keep up with that? How do we continue? Because now patients like it. So what is the investment in that piece of it as well? So healthcare is evolving, but these are the top 2, I would say.
I have to agree with you on workforce. The community I live in is very expensive. And when you get, people just starting out early in their careers, it's really hard to come to Santa Barbara and rent an apartment. And it's not exclusive to Santa Barbara, believe me. We all know how expensive it is to live in California, and California's not the only place. My kids are in Florida, and they're always complaining about, the price of housing. So, finding really good people is easy. Getting them to move to our location has been difficult. So I would say, raising money to continue to expand and do the work that is important, and then recruitment.
Yeah, I would say ditto. And I think also just our staff feeling burned out with COVID. I mean, we never closed our doors at Ronald McDonald House Charities. We did have a period where we stopped accepting new families, but that was a very short window. So, our staff was just always there, always present, and feeling very much burned out. So that's something that, I came from a staff meeting today where we had an all-day retreat and really trying to pump people up. And I've been focusing this year in my new role on professional development and giving staff that TLC that they've been looking for. But retention is number one for us, and making sure that our staff feel loved and appreciated. But yeah, I think once we have to actually replace staff, it's been very challenging to find the right talent.
I agree with everything you said. That is recruitment and retention. And it's interesting. First, it was the great resignation that people have been talking about nationally. It wasn't necessarily that, everyone was leaving our place. Let's make sure I'm clear on that. In general, just people just making life choices. We have a leadership team that is made up of women. We have an all-female executive leadership team, and they had children. And guess what? Schools were closed, childcare was closed. We were dealing with it and filling it ourselves. But at this point, looking for our ECE staff, which are the teachers who were working with the children, who had that exposure, that was dealing with COVID right alongside because they weren't vaccines and things for the children. And then also our housing and mental health providers. So now people are feeling stressed out around what's going on in the community with COVID and trying to help, counsel people, and they're feeling that level of burnout. So retention, recruitment, making sure we can pay that living wage. It's not just Santa Barbara, as you said. Anyone that's lived near downtown, anywhere near downtown Los Angeles can tell you it's incredibly expensive. So we want to make sure that they're whole. That's what we said during the whole pandemic. We didn't close either, and we wanted to make sure that staff felt whole and our program participants, and that wasn't an easy thing to do. So recruitment and retention. So I'm hoping that some of you will live near our offices, and whether it's Linwood or whether it's downtown, and find your way to us at some point.
I realize this next question might not apply to all of you, so don't feel pressured to answer or anything, but there has been increasing pressure on hospitals and the healthcare system as a whole to reduce healthcare costs. What does your organization do to help reduce costs, or at the very least, keep it from increasing any further?
Well, first of all, we don't turn anybody away for the inability to pay. So, that's a little different than the cost of running our organization. And so, one of the things we have a very strong financial team, and we have to look at every line item and be very careful that we're not, that we're being very efficient with our funding. One of the things that's really important to us is, because we rely in part on philanthropy for our money, not just federal dollars for research, or we work a lot with industry, but we get a lot from the local and national community in philanthropy. And as a donor, you want to know that an organization is using your money wisely. That's really important, because you don't want to give to an organization that does the opposite. And so we're very careful about how we spend our donor funds, all our funds. And we're held to a very strict standard. And one of the things, we're subject to an audit every year. And so we have to keep a tight rein on our dollars. As far as how to reduce our costs, well, that's a tough one, because, in this time of inflation, everything has gone up. Band-Aids, and whatever it is, gowns, gloves, the surgical masks, the N95s, the KN95s, everything has gone sky high. So, we basically do a lot of work to try and find the best deals that we can. So that's some of it.
So I think just overall, the question is healthcare cost, number one. So if you look at the data, US spends the maximum amount of money in any country in healthcare, but our outcomes are not even in the top 10 in the world. So just numbers here, I think the average is about $12,000 per capita that we spend in the country, in the US. The next is 7,000, which I think is Switzerland. So with that being said, like you said, cost cutting is a very difficult thing, but what we are doing in our organization is looking at right sizing. Are we just having people do the same thing over and over again? So looking at our processes, doing process improvement, but also I think the important thing to remember when I talk about the cost of healthcare is just having a high costly healthcare system doesn't mean that's quality care. And that's what we all need to participate. And even when you're in training, and I'm assuming you are motivated to be in healthcare, just expensive healthcare does not lead on to good outcomes. And I think when we all come into agreement with that at a federal level and at state levels, that is what is going to impact. So cost cutting is difficult right now. What we are trying to do is increase our revenues and asking the feds for more money in order for us to sustain.
We're not directly, in the healthcare arena, but I would say the prevention work that we do at St. Anne's Family Services helps keep costs down overall. The work that we're doing with the families and parents around mental health counseling and assessments prior to needing to be hospitalized, the assessments that are done on the children early on, so if they need some occupational services, that's caught early and not waiting to go down the line. The lack of prenatal care, where they're now dealing with the maternal health disparities that we hear so much about, and infant deaths. We're working to prevent those, because all of those services being in the NICU for many months, all of those things are somewhat preventable. So the work that we're doing with the dental screenings and all of that looks at trying to keep the costs down eventually for the system, not just individually. So I see us working on helping in that way. And we watch the dollars too, because we have to make sure we spend wisely.
So I think for us, it's obvious in terms of like the room nights and what families are not having to pay to stay close to the hospital. But I think also if you think about families who would normally have to travel long distances, who might miss appointments, which then impacts the health outcomes and how long it takes for a child to recover and how much longer they need to be seen by a doctor. That's also, I think, the impact on cost cutting for us at Ronald McDonald House.
Thank you. So I'm going to switch gears a little bit, and the last few questions are going to be helping our students here tonight prepare to be future healthcare leaders. So what is something that they could do to help your organization in the future when they're in the workforce, to help organizations like yours overcome these challenges you've discussed?
Well, I think really being innovative and thoughtful. I mean, I think whenever you enter into an organization, and I try to keep this top of mind now that, before you know it, you go from being a student to being, a working professional for almost 2 decades, and you want to stay fresh and innovative and thoughtful and open to ideas and informed, by reading the appropriate literature and like listening to, podcasts and listening to experts in your field, so that you stay fresh and thoughtful and innovative, and that you're bringing fresh ideas to the table. I think that for me, that's one of our values at Ronald McDonald House Charities is innovation. And I think in order for us to really be thoughtful about how we address these issues that come up, because it's so dynamic and it's always changing, we need to be thinking of fresh and new ideas.
Thank you. Similar. Stay curious. Look at what's happening. What is it that you want to address? What do you want to learn? What do you want to experience? It's important to, I know this sounds so incredibly basic, but it's something I tell every person that comes through our door at St. Anne's Family Services. You have to start with really and truly caring for the people that you're going to work with and you're going to work on behalf of and serve. And you say, well, that goes without saying. It doesn't. We're in a very divisive time with so many things being said about whether it's one culture or another or political views and all these different things. You'd be amazed how people just due to burnout or whatever, just lose that sense of you're here for a primary reason. You're going to work with this individual and you want to see them succeed. You want to help them reach their goal. And if you start from that place and remembering that it's their goal, not your goal, you have a hand in it, because that's where burnout sometimes comes in, when you want it more than they want it for themselves. And it doesn't mean that they don't want to be successful. Well, all I'm saying to you is you want to help them get there. You don't want to be focused on, this is what I want you to do, or this is what I see that you need. You help them get there. So the basics of just wanting to have people like you working in an environment where you're coming to the table curious, open, innovation, wanting to make a difference, and understanding you cannot change 15 years of what they've learned in 2 weeks. I remember being very eager coming into an environment like, okay, we've got this. But you have to remember, it takes time to go through and help those changes occur. So just stay open and curious and care for anyone with the same way you would care for a family member. And that will help serve you well.
So, as to the question how this group could help our organizations, so I guess I think about two things. One is, as you go forward and as you get into your careers and you grow, volunteerism, not necessarily to my organization, but to other causes that are meaningful to you. Maybe you want to volunteer at Clinica, or maybe you want to volunteer at United Way. I think, for me, it's a part of being a good citizen. I think it's really important to give back. I feel very grateful and blessed, and I like to give back. So I do give money to other organizations. I mean, that's another way. Even, we all can afford a $5 or a $10, or perhaps if you're more successful, hopefully you're all going to be successful in the careers you choose. Support a nonprofit or support 2 nonprofits. So those would be the 2 things that I would say that could help your community and help a nonprofit: volunteerism and donations.
And what I would say is leadership happens at any time. So one of the things would be advocacy also, just adding to that piece of it. If you're part of the system, you're seeing it right now. So voice the concerns, if any process issues that you're seeing, to be, voicing that and making sure those are addressed. You are leaders, that's why you're sitting here. You just have to keep practicing it over and over again, and that's how you can help us serve our community in Ventura County. So it starts now. It's not when you finish or you graduate later on. There are many opportunities in healthcare. That's the beauty of it. You can have different levels of growth, and that starts now.
Before we started, we were joking that, the 4 strong female leaders in healthcare up here were bossing me around on how exactly to take a picture, right? But at one point, all of you were sitting on this side of the audience, and you were college students. So can you share a little bit about your personal journey of how you went from being an undergraduate to being, the strong female leader of your respective organizations today?
So I was raised by a single parent. I'm half Mexican and half Algerian. So my mother's is Mexican but born in the U.S. Her parents immigrated here. And so she was a single parent of 2 children. I'm the oldest. And she had a formal education, so I had that support from my mom. But we had to work really hard to get me to college. So I went to USC for undergrad. And I always worked. I started working when I was 13 years old. I worked at Baskin Robbins and Cinnabon and, waitressed when I was in college. So I always worked multiple jobs. I mean, usually 2 to 3 jobs while I was at SC. My mom had taken out significant student loans on my behalf, and then I spent my money on just, my food, my books, and things like that to help offset the cost of that. So, it wasn't like I had a cushy like full ride at SC, but I also saw students that were struggling even more than me, you know, who were really challenged because their parents didn't understand, you know, what it was to be at university. At least my mom understood that experience, even though she was already a mother by the time she graduated from undergrad. And then I went on to grad school at UT Austin, and I got my master's in radio, television, and film. So, you know, continuing my education, moving away from my family was really important. But I think ultimately, you know, I started out in the leadership position really young, right out of college. My first career position was as a development director for a small nonprofit, very grassroots organization. And at first, I started as a development associate, and 6 months later was promoted to development director. And I was 26 years old, had never really done formal fundraising, but because I had a lot of drive and a willingness to put myself out there and face my fear, that's where I feel like has gotten me to this position today. I mean, I never imagined that I would have the title of CEO for a major nonprofit organization. Never in my wildest dreams, you know. And I think you know, I'm an avid Peloton person. I love Peloton. And one of my favorite instructors says, you know, if you're going to start when you feel ready, then you're never going to start. So I have always started and pushed myself to take that next step before I felt ready. Knowing that I would at sometimes feel so nervous to the point of like feeling physically ill, but was like, okay, I'm gonna do it. I'm gonna face my fear. And in these leadership positions, it's saying yes to that fear and those challenges every single day, over and over and over and over again. So I think that's ultimately how you get to that leadership position, surrounding yourself by mentors, people that you trust, people who are going to uplift you, be honest with you about your blind spots and your opportunities for growth and change, but ultimately feeling okay with being uncomfortable and saying yes before you're ready.
And I just have to say, we need to congratulate her because she still is new in her role, and I appreciated you sharing that because I know her as well, and I know how amazing she is. For me, it's similar. It's very personal, you know, when you talk about these things, because I was a young mom myself, and so from being on this side of the table to being on this side, it was a long road, but leadership is key as to what you said. You know that everyone has capacity to be a leader, but there are times when you see and you know you're making decisions earlier on. You're on the playground, you know, helping set up the games. You're the person that wants to coordinate and lead. And I too came from a family, my parents didn't finish high school, but they were hardworking people. I grew up in a community that was, you know, under-resourced. And I became pregnant as a teen, and then still went to college, still struggled and did what I had to do. I worked as well, juggled taking care of my child. Was blessed to have my child's father in my life, who then became my husband. We've been married now for 35 years. But I say that to say, it is important to see who you can be regardless in the midst of the challenges. Were there people who may look down on your choices? Yes. But you have to know that you have the capacity and you have what it takes to be the leader. Maybe other people couldn't see it. You have to have that level of resilience and a sense of self to be able to go and do what you need to do. One thing I will tell you is internships. You talked about volunteering. I will tell you, if you have an opportunity for an internship, take it. My first job out of college was based on, I did an internship, and they said I was the first person that they hired full-time out of the internship. No matter what role you take, show up and be 100%. Give your best. Be committed. Be innovative. I came up with new things and new ideas in that organization that they had never thought of. Stay curious. So I'm blessed to be here. I'm fortunate to be here. I didn't take the straight path. I didn't have, you know, I have talks where I talk about some people will grow up with a silver spoon, some a plastic spoon, and some no spoon, okay? Definitely didn't have the silver spoon. but I'm here and I know what it's like to work with young people who have had some of the similar challenges. So stay curious, take any internship opportunities, volunteer, speak up and ask for what you deserve, because people won't always give it to you. I had a young woman in our program, we said it at the same time one day. I said, a closed mouth doesn't get fed.
So my personal journey into healthcare I didn't start from college. I'm from back east. I was born and raised in Brooklyn. Some of you that are familiar with the New York accent, you probably hear it. Every time I say coffee, everybody laughs at me. But what I did was I decided after graduating from undergraduate school, I decided to go to law school. And I became a lawyer, and I was in the state of Florida for a long time, and my legal career was in public service. I basically worked for a legal aid foundation that provided, free representation. So in an effort to level the playing field, because I represented people who couldn't afford lawyers, and they were going up against people who could afford lawyers, whether it was in divorce or landlord-tenant. I did a lot of work during the AIDS crisis as well. Unfortunately, we lost a lot of single parents, and there were a lot of kids that needed guardianships, adoptions, and the like. And I did that for many years. But what changed for me and what got me into healthcare was that my oldest son was diagnosed with type 1 diabetes at age 13. And that basically turned my world upside down. And so it was then that I decided, through advocacy and donation and volunteerism, I got involved with a National Diabetes Organization. And then eventually I left Florida because I knew California was the better place to be. And I worked here in California as executive director of the Legal Aid Foundation of Santa Barbara County, and I ended up joining the board of trustees of the Sansum Diabetes Research Institute. So I continued my volunteerism and my work in diabetes. And then one day they needed a new leader, and they said, you know how to raise money, you know how to run a nonprofit, because I did. So why don't you be the interim executive director? Well, I gotta tell you, I thought I died and gone to heaven, because I was able to take my passion for diabetes and make that my profession. And so I felt very, very lucky. And you wouldn't think necessarily that being a lawyer was the best route to being in healthcare, but it actually is a very good route. There's no one way, there's no one profession to get into this field. There are a lot of different routes to get to where you want to be in healthcare. And so, you don't think narrowly, think broadly. That's what I would say.
Okay, my journey is a little bit different. So I was born and raised in India, and I was the cliche physician. So I am a trained family physician. And if any of you are in pre-med or no doctors, we are very to the point. We don't see left or right. You've got to just take care of your patients and you move on. But my journey included, I wanted to serve the underserved community, not just in India where I grew up, but I worked for a couple of years in Botswana, which is in South Africa, close to South Africa, and similar path. But it's just, healthcare is broken everywhere, and it's now in 3 different continents that I've seen it. It's broken. And in order to fix it, just my being a physician and seeing, 450 patients a month was not making an impact. And I wanted to be heard, and I wanted to be heard in a way that the changes were happening. So stepped into the leadership path about almost 15 years ago, and in that journey also decided that, hey, I need to have an official degree, so did an MBA in the path as well, being a physician. And I say I'm blessed because I didn't have to choose between motherhood or a career, and I got to do both of them. So to all the women out here, it's not, don't have to get everything done at the same time. And when I did my MBA, I if somebody told me a decade ago when I finished my med school and my residency, hey, you'll be going back to school when you have young kids, I would have said, you're crazy. I would never do it. And I would do it again in a beat of a heartbeat, because it's just been tremendous to be making this impact and having that knowledge behind. So for everyone out here, that's what I would say. All our journeys are different, but I think we all sit here by saying one thing is common between all of us. We didn't have to choose between being a parent or being successful career women. So that should be the key message here.
Okay, my final question before we turn it over to students. We talked about what the students can be doing now to, prepare to be future healthcare leaders. Once they graduate and they're in the job market, what recommendations do you have for them to secure employment?
I'll answer, really try to be brief. I do want to just add a piece to the reason I shared my personal story with you in that piece was because everything that you've gone through in your life helps you get to where you need to go. So just to be clear, it was connected with the work because your life and your journey will impact how you lead. But I think you need to, what I said earlier, do your best in everything. You may think, oh, this is just a class, I don't need to get an A, or I don't need to give my all. You don't know if that professor or that person that, once you've graduated, maybe that person that knows someone else that says, oh, she'd be excellent. I'd write you an excellent reference because you were an amazing student. When you get into the work environment, sometimes you try things and you realize you thought you wanted it and you don't. You may get a whole degree in something and you realize that's not something that you want, but you go forward and you do your best. Ask questions, network. I think the value of networking, I don't know if it's just with what's happened with social media and not connecting and all the things that have gone on. It's important to network with each other. Ask questions. You talk about having a mentor. Do you have a mentor? Is there someone professionally that you aspire to get into that field that you're asking those questions? What should I do? What steps should I take? It's important to surround yourself with people who can help you along that path and that journey, and ask questions. And it's okay to make mistakes. Just course correct, get the support, and go in and be the best at whatever it is you do. And you can do many things. That's the last thing I'll say. I am a CEO, I'm an author. I laughed when you said you had the background with television experience, all of that. I would rather be a has-been than a never-been.
So what do you want to secure? Again, I think you have to be passionate about what you want, number one. If you don't have passion, don't do it. That's my one advice here, because no matter how you get to it, to your final destination, it'll happen if you know what your passion is. And your passion sometimes does change while you're getting into that. And that's okay as well. So one thing I would say is, the question is, how do you secure? Don't worry about jobs. If you're doing the right thing, you will find a job. There are plenty out there. Especially right now, there are many there, and maybe you don't want. I'm a person who's followed the traditional path of getting a professional life, and I think it depends. It may not be for someone else, and you will be here probably in a decade, you will be sitting here. So that should be the goal. I think for most of you here should be, how do you get here and what's your passion? Find that passion, you will find a job with that.
So if some of you in the audience think about jobs that require additional training, maybe you want to be a doctor, maybe you want to be a nurse, maybe you want to be a respiratory technician, and the climate in schools for advanced degrees are extremely competitive. And one of the things our organization has done is we hire young people who have degrees in science, biology, chemistry, things like that, that aspire to be in the clinical space in some way, a nurse practitioner or a physician, and are interested in research. And I'm saying this because we, over the years, have had a number of college graduates who have come and worked with us for 2 years And every one of them that wanted to go to medical school has gotten into medical school. So if you're thinking about going for that advanced degree, I would recommend that you think about getting some work experience some way in your field, something related to your field, because it makes you more competitive in that graduate school space. So that's one thing. The other thing is, I totally agree about passion. I've been really fortunate in my life because I've had two main jobs, and both of them fed my heart. And I could really throw myself 110% into what I was doing. And I feel very fortunate to have, to have that gift. It's a real gift. Because I bet you know people that, oh, I hate my job. Oh, I have to go to work tomorrow. I've never felt that in my life. And I hope for all of you that you find a job where you're just eager to go and you're excited to be there and you want to work hard and you want to give 110%. For me, having a strong work ethic is one way to prove yourself. You want to show up. You want to be early. You want to be the first one to volunteer. Say, I'll do that project. I mean, these are all things that impress bosses. And this is how you can climb a ladder within your given field. The other thing for me, coming from the East Coast, is I like people to dress for success. I am a real stickler for it because I'm from the East Coast. So, you can't wear blue jeans in my job, in my building. You can't wear flip-flops. I mean, you can't even wear open sandals. Part of that is because you need closed shoes in a healthcare facility. So that was an easy one to do. But I'm telling you, while we don't want to judge a book by its cover, it has meaning. When you go in for an interview, you want to look like you respect this workplace. So you've put on your best clothes, okay? And that doesn't necessarily mean a suit or a fancy dress, but you're neat, you're tidy, and I really think if you look good on the outside, it gives you confidence on the inside. So work ethic, a strong work ethic, dress for success, find a passion, think about working in a field before you go for an advanced degree. I think these are all things that can help you get ahead. The other thing is, I think that there's a lot of statistics that you can use Google and find about the areas in healthcare looking to the future that are going to be the most sought after. I know there's a terrible nurse shortage, a terrible nurse shortage in our country. So some of you might think about going into nursing, and then maybe you want to go into nursing administration, and then maybe you want to get your MBA, and you can do that stuff on weekends. So, and these are the things that one other thing. I would recommend that if you can, learn Spanish. Because I think being bilingual in this 21st century, the Hispanic population is our largest minority, and at some point down in the future, I believe it's going to be the majority. And so you want to be able to relate to your patients, to your coworkers. I think it would be very important to learn Spanish. I'm a little old. The younger you are, the easier it is to learn a language. So don't wait too long. Those are my thoughts.
So in terms of the networking, I think it's not just connecting with people, it's not being afraid to reach out and call on people, even if you haven't talked to them for years. My cousin texted me last night and she was like, hey, do you know of anyone that has a place for rent in Montebello? And so I was like, okay, let me think. And so I text two people that I thought might have a contact, and right away they text me back. They're like, oh yeah, we have a place. And my cousin was like, I knew you were the person to ask, because she knows. One of the people I text was someone from high school that I hadn't talked to in months, but she knows that I'm willing to reach out at any time, and I'll be really kind and like, how are you? How are things? Hey, quick question for you, right? And that person knows that I'm also there for them. So it's maintaining that mutual relationship and making sure that you are also there for that person, but not being afraid to use your network. So don't just network, but be willing to maintain those relationships and feel okay with reaching out to people. I think that's really important. The other thing, which I feel, we've all touched on, is that humility. Once you graduate, understanding that you might not have the ideal job right out the gate. When I graduated with my master's, I thought I'm gonna have any job that I want, but I was humbled right away. And I started working at the Ritz-Carlton part-time, and then I worked at LandSafe Credit, where I was verifying credit reports all day, calling creditors to verify credit reports for people applying for homes. And this was me with my master's degree, but part-time then I was working at nonprofit organizations with part-time jobs and volunteering so that I could start meeting people and trying to make a way, because I didn't have those connections initially, and I knew what type of job I wanted. I knew I wanted to work for a grassroots organization. I didn't want to work for a large nonprofit organization, so I started to volunteer and find small part-time jobs within the organizations that I was interested in working in. So it's being creative about how you're going to make your way into the field that you want. The last thing I'll say is the Gallup StrengthsFinder test. I don't know if you all have taken any type of personality test, but I really like Gallup StrengthsFinder. It gives you your top 5. You just take the test online quickly, but it tells you based on your innate talents, these are the types of jobs that are ideal for you. So if you're like, I know that I want to be in the healthcare field, but I don't know exactly what type of job I want, I would recommend the Gallup StrengthsFinder test to help you find out what is it exactly that you're really good at that would lead to a specific type of job.
Can I just add one quick thing? Feedback. When you were saying that, it triggered for me. A lot of us are uncomfortable receiving feedback, and we have to actually start from now asking people, how do you think I'm doing? Give me some feedback on pointers on how you think I could do better. Where are my areas of strength? Where are my areas of challenge? Because if you start and utilize that process now, when you go into the work setting, it will allow you to be a better supervisor as a leader because you know how to utilize that process effectively, but also it's not so, like you cringe, oh boy, I'm bearing for bad news. No, it doesn't mean that. It means that you know how to effectively receive it. How can you use that information to grow at the end of the day? So start to get comfortable from right now with feedback, giving it and receiving it, and understanding how you can grow from it. I think that's critical for any role.
Thank you. Any questions from the audience? Okay.
So quick question. I just wanted to know, how do you even go about starting a nonprofit? How does this even come to be?
There's a great book out. It's put out by Nolo Press. You can get it from Amazon. What can't you get from Amazon? And basically the title is How to Start Your Own Nonprofit. So just get that book and it'll give you step-by-step instructions.
I would say, though, I encourage anyone before starting a nonprofit that you look to see what existing nonprofits there are, just to make sure that if there's an opportunity to enhance something that's already the idea that you have, and you can go in and enhance. Because when I was out of grad school, I wanted to start a nonprofit. But then once I started to realize that the landscape of nonprofit organizations was so huge and that there wasn't a lot of need that wasn't being addressed already, I didn't want to be competing for funds with other organizations. And so I wanted to work for then an organization that really spoke to my passion and my mission in life, my values. So I would just suggest that, because if you have an idea of a need that's not met, then absolutely start that organization. But if it's already being met, then you really want to do your research.
I think you might also consider working for a nonprofit, because there's lots of pieces in running a nonprofit. There's just so many angles. the biggest thing, of course, is raising the money. And when you're brand new, a lot of funders don't want to take a chance on you. So then there's also the possibility of having a, you know, a financial, I'm not thinking of the right word, but you get backing, a financial, it's not money, but it's processes. Like for instance, a foundation in town, like I'm sure there's a Ventura County Foundation, huh? Fiscal sponsor, thank you. You know, and that's very helpful sometimes for a new nonprofit. Like I said, funders, you know, they like nonprofits that have been around and, you know, they have a track record. And so that's very important. So you might think about working for a nonprofit just so you get a real idea of what it's like when you're in the trenches.
And I just want to add, like, as in understanding what a nonprofit is. Nonprofit doesn't mean that you don't make money. It actually means, the definition is that whatever the revenue is, you put it back in the community. So that's one. And there is also non-for-profit companies that are out there. So for a healthcare organization, it's a very different thing. We get federal funding. You have to have that label. You do a service assessment, needs assessment for the community, and that's how you make one. But you need capital investment for sure in this.
So earlier you guys all mentioned that workforce was one of your biggest obstacles within your organization. What are ways you guys are showing appreciation to keep the retention?
We've done quite a few things. We've actually increased wages in certain areas. We do a lot of morale boosting activity, recognizing people. Sometimes it's with public recognition, sometimes it's an award. We've done, you know, even recruitment bonuses. If you refer someone who comes into the organization and stays for a period of time, that there's some incentive. But we're really working on wellness. We talk about the whole person, mind, body, spirit, all the different things. We put in a wellness center since COVID started, so people can go and exercise on their break. We have a whole entire gym. We've never had that before. We've done fun things. You know, we're talking about doing something now where we're going to allow people, you know, LA is very creative. Everyone has 2 and 3 things that they do. So we want our employees to get a chance to learn about their, you know, folks and their like side hustles, as they call them. So we're doing something where we're going to actually allow people to come in and share their talents, their things that they're selling and doing. So we recognize who they are in their totality. But we really have been working on listening, having different opportunities to sit down and say, what is it that you need from us? What makes you excited to stay at St. Anne's? Why have you stayed here? And then listening if someone leaves, what has caused you to leave? And looking at how we can adjust that. So from financial to morale building, to having conversations, to really just understanding, once again, you know, things are going up. Can they work from home? Can they, have a flex schedule? That's been important as well. Some people said, if I can work from home 2 days a week, those are options that aren't available, you know, in our housing programs or some of our other programs, but our telehealth and some of the other things can do that. So we've been working on a lot of things, and even recognition on our social media. We've been allowing them to share their stories, and they've been posted, and they show all their friends, like, look, I'm getting recognized here at St. Anne's Family Services.
One of the things that we've implemented is coffee with the CEO. So once a quarter, I invite the staff, and we have 2 different times of day where they can come online, and I present to them about different topics. And it's an opportunity for the staff to also get to know each other, because we're all over Southern California. We're in Ventura all the way down to Orange County, you know, so in Idlewild. So that's an opportunity for everyone to connect online. I also have implemented CEO office hours. So every Friday I have a 2-hour block of time where staff can sign up for one-on-one time with me for at least 30 minutes. For me, that transparency and communication and accessibility is really important. One of the things I was telling the staff today at our staff meeting is that the hierarchy in our organization exists not to divide us and for people to feel that power dynamic. It exists to understand the accountability structure and who is supporting you. So that's one of the things I was telling the staff. Like, you all, I am like you are like me. We all have a role. We all are important in this organization. My title does not make me better than any of you. It just says that I am the one who is most accountable in this organization. I'm the one that has the biggest responsibility. So that, for me, I feel is really important for staff to understand that their value and their importance in the organization, and that's something that communicating with them and being transparent has been really important for us.
One of the things that I do is I encourage professional development. If there's a conference, I encourage my staff to come to me. I just sent our regulatory manager to Las Vegas for a full week's conference because it was really critical to her professional development and to network with other people that are in her field. And I very much encourage that. Right now, I am supporting one of our LVN nurses who is in an RN program. And I'm giving her her full salary while she's going to school. And we don't do coffee. We have once a month sip and snack with wine. And then another thing I did was Employee of the Month. So I asked the staff to nominate various employees, and the employee gets up. We have 2 parking lots. One is adjacent to our building, and it's very limited. And then one is a couple of blocks away. So the Employee of the Month gets to park in the Employee of the Month spot that's adjacent to the building. Plus they get a $50 gift card, and then they get this silly little trophy that I bought online that says, "Great job." You know, people, and they love it. I mean, they love it. It's like right here. There's lots of ways, and I think, the overall theme is that people need to feel appreciated. And they want to be appreciated for their work that they do and the person that they are, and I try really hard to make them feel that way. We have a great staff, and so I don't have to fake it. It's genuine. And, there's lots of ways. Another thing that I think is important in this day and age, and I think you touched on it, and that being the difficulty of being a professional and raising children, especially it's not exclusively the mother in the home, but more often than not, it's the mother who has to make the decisions between a sick kid and a job. Now, I'm old enough to where a couple of my jobs early on, it was frowned upon to say, "Oh, I have to stay home because my kid is sick." And I used to say, "Oh, I've been up all night, I have terrible diarrhea, or I've been throwing up," if my kid was sick. Well, that was many, many years ago. And so having had that experience, I recognize children are a priority. And if your kid is sick, you can work from home, or even if you can't, go take care of your child. You have sick hours, go take care of your children. And I think it's very important, whether it's the father or the mother, to communicate that we recognize that family comes first.
So we have approximately 900 employees, and being on the front line for 2 years, burnout is pretty high. So how do we appreciate them? So what we did was, in September, we did a company picnic. We had over 1,000 people show up, which is obviously staff members with their families. And that was a way of appreciation. I mean, again, we talked about, we are already, all of us are seeing high dollar amounts in the healthcare system right now, but to do that was very well appreciated. The other thing we did was, I think the major thing is today, everybody wants to be heard. I'm sure you all feel you want to be heard, your voices to be heard in your future jobs as well. So we did focus groups because hearing 900 people is really tough. So we did focus groups, understood what they wanted. I mean, basic things, which was like, what is job satisfaction? And one of the questions, and somebody said, I need the coffee to be different in the lunchroom. That's an easy fix. So we fixed it. And that employee is here, I guess, still now. But those, sometimes it feels like there is a bigger problem and it isn't, but just hearing people, and that communication channel has been opened. We do the Employee of the Quarter, as it was on TikTok, and I'm sure you all know this, healthcare, we were a part of it. We made TikTok videos while doing COVID testing, being out with our mobile vans, and we all danced. I think that was the most fun thing, and you're not allowed to do that in healthcare. So, I led that. We danced all together. So, but lots more to do, I think.
Well, I know Fatima pretty well, and I think she's going to be implementing wine with the CEO soon after Ellen's suggestion. Yeah. She's like, oh, why didn't I think of that? Oh, yeah. Okay, any other questions?
So my question is, how do you personally ensure that you are implementing diversity, equity, and inclusion within your personal lives and with relations to your professional lives? Because as we were all talking, it's really important to represent the community that you serve, right? And with healthcare, especially in this area, it's being bilingual, and not only bilingual, but also bicultural. So how do you do that?
That's a wonderful question, and it's something that's extremely important to us at St. Anne's Family Services. It's interesting, I'm the first Black woman to run an organization in over 100 years. My presence alone, and I thank you, I don't say that for claps, I'm saying that because my presence alone started kind of a part of a movement. Because that meant that people were open to really looking at my skills, my background, and seeing what I bring to the table, my degrees, my education. But I went in the door questioning and saying, okay, what are we doing systemically to ensure that there's even access, there's opportunities, what do we have in our policies that someone may not have even realized could be problematic. We have a JEDI, we call it JEDI, our justice, we call it the JEDI committee. We have a JEDI committee that we started. We talk openly around culture and race, and our all staffs. We cried together when things happened in the community, when George Floyd happened, his death. There were so many things going on. We were dealing with COVID, we were dealing with all of that. It has to be real though. People can tell when it's not real. I will tell you. I've seen organizations have slogans on their website, say all kinds of things, but you know when it's genuine. We have actual an assessment matrix to look through our policies, to look at our hiring, and I'm not just talking about all types of diversity. And looking at where we're missing the mark, starting with our program participants. What do you see us meeting? What are we missing? And then implementing that little by little to make sure, and there are times when things need to be changed right away. And so it's real to us, it's real to our staff. They're held accountable for that in their performance evaluations. See, what's not measured, you know what happens. It's a part of their performance evaluation that they have to be working towards justice, diversity, equity, and inclusion. And it's not just something that's on your website. And you asked about personal. I remember years ago, I was actually a diversity trainer for many years. And that has helped me with this work. And I remember one time we were in a workshop and my co-trainer said, let me look at your photo album. If I looked at your photo album right now that you have at home, that would tell me a whole lot about your friends and who is actually in your community. And I never forgot that, because yes, it's one thing what you do at work, but if you truly value diversity and inclusion, you should have, and this is just my opinion, you should have that reflected within your personal life, because you would seek that. It may not happen naturally, but you would seek it. So I think you have to actually have a structure that people are asked to learn and understand, not something that's punitive. It's okay to make a mistake. I don't want people to get caught up, well, can I say this, can I say that? Let's talk about what this means to our program, our organization, our staff, and the people that we serve, how we behave, how we respond. It goes back to my scenario earlier. You have to care about the people. If you don't like people or you have a bias and you're treating them a certain way, you cannot be effective, healthcare or not.
For us, within our strategic plan, we have 4 pillars, and diversity, equity, and inclusion is part of one of our pillars, part of our strategic plan. And I was just talking about that today with our all staff, that this is going to be a major focus for us for next year. And not just, okay, we're going to focus on DEI next year and that's it, but it's really what, to Lorna's point about how is this really implemented, integrated into the culture of our organization, understanding how our values of inclusivity is about bringing people who are normally on the margins, who are not thought of or considered or part of the conversation, are comfortable enough to be their whole selves and know they're going to be embraced in our organization. That's at the end of the day what it's about. I think the biggest challenge for us is not necessarily on the staff side, although there are some challenges on the staff side. It's really the board of directors side. Our organization is unique in that every single program has its own board of trustees. So even though they're not a fiduciary board, they are fundraising board, and all of the boards look different. But there, is one board in particular I'm thinking of right now, one of our programs that I would say 95% of their board are white males. So and in Long Beach, and that's problematic because Long Beach is a very diverse community. You want to make sure your boards are representative. It starts at that leadership level. It's representative of your community. So we have an all-board retreat that's happening at the end of January, and I have a DEI consultant coming in to do a presentation, and the board members are going to go through and set their own goals about what does diversity, equity, inclusion look like for you on your board. I'm not going to dictate, right? It needs to come from within the leadership, and they need to take ownership of it. I can't come in and say, this is what you all need to do. It's, bringing in experts so that they understand why it's important and that those goals come from them.
I think it's very important what you both have explained. One of the things that resonates with me a lot is that our staff and our board of trustees should reflect the population we serve. And we try very hard, and finally, I think we've gotten to a place where it does. But for a very long time, it was white males. And I feel so much better about it, but we're not done. That work, that DEI work has to continue. It has to continue with your staff, and it has to continue with your board. One of the things that I find really interesting in the last year or two is foundations, when you submit a grant for money, they ask you about diversity, equity, and inclusion. They ask you about the makeup of your staff and whether it reflects diversity, and the makeup of your board and how that reflects diversity. And so I think that's a really good thing because, once the foundations start asking for it, those nonprofits that are, a little slow to go forward are now, basically it's a forcing function for them to take a look at who's on your staff, who's on your board, who do you serve. These are all very important questions. And so I was very glad to see that starting with foundations.
I don't think if 10 years ago we were here, this question would have been asked. So it's really important. And for that reason, actually this year we created our core values for our corporation. And one of them is diversity and inclusion. And with that, what we are doing is we do actually have on a quarterly basis ask our staff members to give examples of those core values. We have 5, but I'm just going to focus on this one. And as to how they feel that they are give examples of this particular part when they're seeing patients or in non-clinical settings as well. The other thing is we do our annual employee survey, in that we have certain questions for diversity, inclusion, and equity as well. And what do they understand? Because there is always implicit biases, everybody has it. And recognizing that and be conscious about that is very critical as well. So so answering personally, I'm well aware of my implicit biases, and I make sure that I keep those in a separate bucket and that doesn't become a part of the characteristic as well. So it is something, and we do I think it is quarterly reports on even employees that are employed, what is their backgrounds, what is their ethnicity, and we have a very diverse culture in the organization.
Thank you. And as we wrap up, 2 students were randomly selected to win either a CSU CI Heals hoodie or a mug. So is Vanessa Villegas still here? Uh-oh, she lost out. Mariana Garcia? Okay, all right. And now Miguel Rojas? He's gone too. Razmi's still here. Razmi's the next one. So first of all, round of applause for our panelists. Thank you, ladies, so much for coming out. 3 of them had a decent drive to get here, so we appreciate that. And as a small token of our appreciation, you get your CSU CI Heals mug that's in front of you. And that's it. Thank you, everyone. I appreciate everyone coming.